The United States' mishandling of the COVID-19 pandemic has created a public health crisis and exacerbated a number of socioeconomic issues already faced by the country. These are also all factors that can trigger addiction and opioid use. Like many other crises faced by the country, the overdose epidemic's origins are pre-COVID. In the 90s, many American adults reported suffering from chronic pain. Doctors were pressured by the federal government and advocacy groups to take it as a serious medical issue. Doctors turned to opioid painkillers because drug companies like Purdue Pharma said that they were safer, more powerful, and less addictive than other painkillers on the market.
There's no question that our best, strongest pain medicines are the opioids. These drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
Once you've found the right doctor and have told him or her about your pain, don't be afraid to take what they give you. Often, it will be an opioid medication. Some patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact. Less than 1% of patients taking opioids actually become addicted. And
the claims that opioid painkillers were safe were all lies. This even resulted in drug companies like Purdue Pharma having to pay millions of dollars in fines. But by 2012, over 250 million prescriptions had been written. And because the drugs are so addictive, many patients became hooked. As opioid prescriptions skyrocketed, as did opioid overdose-related deaths. Because of this, doctors began pulling back prescriptions. However, patients that are addicted to painkillers are 40 times more likely to be addicted to heroin. As attempts were made to get the prescription opioid crisis under control, patients switched to heroin. The 2010s saw heroin-related overdoses skyrocket. Synthetic opioids such as fentanyl hit the streets and further complicated the issue. The COVID-19 pandemic hit the nation and was a huge disruption to daily life. The pandemic has had disastrous effects and further complicated the overdose epidemic. Disruption in treatment and recovery, loss of informal social support, interruptions and changes in illicit drug supply, coupled with psychological, social, and financial impacts of the epidemic, has vastly increased the risk of overdose. 2020 has marked the worst year in the overdose epidemic, with 86,000 opioid-related deaths.